Good evening. Thank you for coming to this press conference. The intervention we have put in place over the last few months have helped to keep the number of COVID-19 cases in the community low, at an average of about 1 case per day, and the number of unlinked cases fewer than that. And I want to thank everyone for your efforts. We can now resume more activities, but we will need to do that while keeping everyone safe. Learning from the experience of other countries, the key is not to rush into it, but to do so progressively and cautiously, while continuing to stay vigilant. We must be extra careful with activities that are known to have a higher risk of seeing super-spreading events to prevent the emergence of large clusters. We have taken a cautious approach to events like weddings. Some couples have put off their wedding plans in the hope that they can ride out the pandemic and proceed with their original plans for a large wedding reception, like what we used to do before the COVID-19 pandemic. But the end of the pandemic is still some way off, and indefinitely postponing a wedding may not be practical or desirable.
Over the last fortnight, give us greater confidence that we can extend the pilots that Minister has mentioned, allowing events and social activities to resume safely in our community. But it's important that we must not be complacent. The daily reported numbers may on occasion still rise on certain days in tandem with the intensity of testing that we are doing of migrant workers in quarantine facilities, in and out of the dormitories, and on routine regular testing. We remain vigilant to detect any new clusters that may arise, and we will do our utmost to quickly isolate cases, to quarantine close contacts, and to disrupt all potential chains of transmission, whether these are in the community, in the workplace, or in the dormitories. And it rests on all of us as individuals, as members of society, to do our bit, as Minister has mentioned, in enforcing the discipline for safe distancing, safe management measures, and wearing a mask. Thank you.
Good evening. I'd like to say a little bit more about our plans for workplaces as part of the broader plans for the resumption of activities. In particular, the plans we have for employees to be able to return to work at their workplaces. I mentioned a few weeks ago that there was a tripartite group comprising employers, the unions and workers, as well as the government representatives discussing this matter. Since then, the tripartite group have finalized their agreements and recommendations, and they have agreed on the following arrangements. First, working from home should remain the default or preferred mode of working. But second, if there are employers who would like their employees who are presently working from home to return to the workplace, they can do so, but subject to 2 conditions. The first condition is that the employees must continue to work from home for at least half their working time. Meaning to say the employees who are presently working from home, if the employer would like them to come back, yes, it's possible, but these employees must continue to work from home for at least half their working time. Second, at any point in time, there should be no more than half of such employees at the workplace. So for example, if there is an employer with 10 full-time employees who are currently working from home, he cannot ask all 10 to come back to the workplace. But what he can do is to split the 10 employees into 2 teams, and each team can return to the workplace every alternate week, while the other team continues to work from home. When more employees are returned to work, we also want employers to do their part to minimize crowding and congregation at common spaces, in particular at our public transport. So we also call on employers to implement flexible work arrangements for their employees who are returning to work. In particular, we would like employers to put in place arrangements for their employees to be able to work partly at home and partly at the workplace. So it doesn't have to be such a binary arrangement, right? Either or, but you can be a combination of both. And at the time when the employee has to come back to work, employers should allow them to travel outside of peak hours. For example, they can do so in blocks of 10 a.m. to 4 p.m. or 1 to 5 p.m. in the office, and then the rest of the time they can work from home. So these sorts of hybrid combinations should be adopted by employers. We would also allow for more events to resume within the workplace itself. Work-related events can resume within the workplace. Such events would include conferences, seminars, promotion ceremonies, induction ceremonies for new staff, corporate retreats or meetings. So anything that's work-related can resume subject to prevailing safe management measures at the workplace. But large-scale social gatherings should not be organized either within the workplace or outside. That's the existing guidelines, and they remain the same. So no large-scale social gatherings, for example, celebrations, parties, team bonding events, dinner and dance or gala dinners. These should not resume at this present time. So the only things that would resume are work-related events. So I've just touched on some of the broad arrangements for workplace, safe management measures at the workplace, and for more employees to be able to return to their workplace. There are a whole range of detailed guidelines which the Ministry of Manpower will put out separately, outlining all the various safe management measures. We would also like to emphasize the need for everyone to continue to stay vigilant and to do their part in complying with all the prevailing safe distancing and safe management measures. We would like everyone to be part of the Trace Together program. So if you have not done so, make sure you download the app on your phone, or at some point when the distribution of the tokens reach your area, then you make use of a token if you so prefer to do so. But whether it's through the app or the token, please get on board the Trace Together program, because the more people there are participating in Trace Together, then the greater our confidence is in opening up and resuming more activities. At the same time, everyone needs to take the safe management measures seriously, be it at workplaces or in the community, and continue to comply and uphold these measures. If all goes well, if we can continue to maintain this level of compliance and we can continue to control the infection well, then we will be able to continue with this path of resuming and opening up our economy and our society steadily. We are already working out the roadmap towards phase 3, and we have some plans on how this can be done over the subsequent weeks, and when we are ready, we will share these plans with Singaporeans. But we really need everyone to cooperate and to do their part so that together we can have a safe and progressive resumption of activities in Singapore. Thank you.
Thank you. I would like to invite questions from the media.
Thank you, Minister. Can we have Soon Kiat from Zapao, please?
Good evening, ministers and DMS. Being the biggest employer, will the government also begin to allow more civil servants to return to their workplace? Second question, it was reported that the Malaysian government hopes to reopen the Malaysia-Singapore border for daily commuters in January. Are we also working towards this possibility? The Malaysian side is also looking at doubling the capacity for RGL and PCA. Any response to that from our side? Thank you.
The government, the public sector will adopt what are prevailing guidelines. So with these new guidelines, agencies will look at their own needs, and to the extent that some agencies may have a requirement for more officers to come back, they will do so, but they will follow strictly these existing, the new guidelines that we have highlighted. If there is no need for officers to come back, then we would adopt the same principle, which is that working from home should remain the default arrangement as it is today. So that's the approach that all public sector agencies will adopt. On the discussions with our neighbors in Malaysia, we are continuing our discussions on all fronts, whether it's for daily commutes or the expansion of the periodic commuting arrangement, as well as the reciprocal green lane arrangements. These discussions are ongoing with our Malaysian counterparts, and when we have any new updates, we will share them with everyone.
Thank you, Minister. Can we have Cheryl Goh from CNA? And please keep your questions to one question. Thank you.
Good evening, Ministers and DMS. My question is actually specifically for DMS regarding the announcement from MOM today about the 7-day pilot testing at dorms. Could you explain to us how the new testing, the mid-turbinate nasal method of swabbing, how is it different from the current method, and why does it allow a 7-day period instead of the usual 14 days? Thank you.
Thanks a lot, Cheryl, for the question you've asked. In fact, there are several questions in one, and I'll try to answer them in sequence. First, talking about the method for testing, we've been traditionally using nasopharyngeal testing. That is, using a small, thin swab stick, passing it through the nostrils all the way backwards towards the back of the nose. And while this has seen very effective collection of samples for testing, giving us very good results, we are very mindful that this is not a pleasant experience. And for individuals who have to do this on a very regular basis, currently the construction workers, those in the CMP sectors have to do this every 14 days. This can be, over time, a very traumatic experience. Sometimes, if this is done forcefully, you can even have nosebleeds, and therefore the workers might develop some aversion to wanting them to comply and continue with this process of regular testing. So we've been exploring different other ways of sample collection for our tests, and what we're doing now, and we are rolling this out progressively in phases, starting with our regional testing centers, and we hope to extend this in all other test settings, including in the hospitals, in the polyclinics, is to use an alternative means that can give us also a good sample, but hopefully without such a high likelihood perhaps of discomfort and potentially other complications. So this involves using a swab stick again, but instead of passing it all the way towards the back of the throat through the nose, it's just midway. And to where we in medical terms, we describe this as where the middle turbinates are, and getting a sample there, supplementing it with a second sample that comes from the back of the throat. Over time, we will be also studying whether or not we actually need these two sites for sample collection, and whether or not we might be able to dispense with one and just stay with one particular site of collection. But we need to validate those processes, and we're in the process of doing so. We are also committed to explore other possible methods, and that includes obtaining deep throat saliva specimens to see whether these might be effective alternative ways for sample collection for testing. But our studies are still in progress, and we are not currently in a position to to shift towards using saliva testing at this point in time. So that's one part in terms of our way of trying to make testing a much more pleasant experience for those who are subject to testing regimens. Together with MOM, we've also been discussing whether we can be more proactive about picking up infections as early as possible. And this is in particular in high-risk settings where workers might be staying in dorms with communal living. They are going out to work. It is difficult to completely prevent mingling that takes place. So the environment is rich for a high risk for spread to take place very rapidly if any one individual within that community gets sick. And rather than just simply depend on the high precision and accuracy of our tests, we think it's also important for us to explore other ways of varying our testing, our surveillance. And one option that we are studying very at this point in time is to increase the test frequency. We test more often to see whether or not this can give us an opportunity to detect infections earlier and allow us then to intervene more decisively to break up chains of infection, prevent them from forming large clusters, and therefore allow for an opportunity for workers to continue to work in a safer environment, and also to prevent the disruptions that will take place when large numbers of workers have to be quarantined as a result of picking up positive cases during these testing regimes. So we will be starting off with doing the study in one of our dormitories, and we will start off with a 7-day testing cycle. And we may, at the end of the study, decide whether this is a regimen that can be safely extended to other dormitories. It may also allow us to think about more tiered approaches where higher risk dormitories might engage in higher frequency testing, whereas other dormitories might engage in the traditional 14-day cycle. So we are open to these possibilities, but we need to test and study this more closely. And we'll start off first with the study that we are doing in this particular dorm.
Thank you, DMS. Can we have the next question from Timothy Goh from ST? Please be reminded to keep your questions to one question. Thank you.
Hi, thank you, Ministers, DMS. I would like to ask what phase 3 will look like and when the restrictions on 5 people gathering will be lifted, given that we seem to be opening up everything else. Thank you.
I'm not sure if we are opening up everything else. We are still doing things in a calibrated and controlled manner. As I highlighted, we are charting out the roadmap to phase 3. It would include further relaxation and opening up of activities. For example, in terms of border measures, we can expect further opening up for travel with countries that are safe. Within the community, then we will look at a range of other measures, including the rules around dining, the number of people. The rule is 5 today. We might be able to allow for a higher number, as well as the rule around visitations. Again, that same number 5 applies, and we might be able to allow for a larger number too. We also would include we would also look at the rules around various events that are happening. We announced today some relaxation for places of worship, for weddings. So as we embark on this roadmap towards phase 3, some of these measures can also be relaxed to allow multiple zones of 50 greater than what we have today, which is typically around 50 times 2 or 100 people. We could allow for more. So these progressive steps of opening are part of that roadmap towards phase 3. And as I said earlier, we will work through the potential pathway to phase 3, and we will share that with everyone when we are ready, perhaps in a few weeks' time. What's critical and what's very important for all of us to understand is that this progressive trajectory towards continued opening is contingent on all of us doing our part. It's not to be taken for granted, and it's not an automatic progression. It's contingent on all of us cooperating as I said, being part of the Trace Together program, complying with safe management measures to ensure that contact tracing is effective. So together with that, as well as our continued increase in testing capabilities, I think all of that will give us confidence to continue with this trajectory towards steady, controlled, and safe reopening.
I should perhaps add to say that even as we move towards phase 3, you will also realize that from time to time, we may need to tighten some of the measures in our safe distancing and safe management measures. For example, the increased frequency of RRT for selected dormitories which has higher risks is one area that we are tightening to make sure that we minimize the risk of big clusters forming. And we may need to do this tweaking as we go along from time to time based on our risk assessment on the various activities and various sectors. So it is not opening all the way, as you put it. It's basically a calibration. We need to open somewhat to allow the economy and the social activities to resume. But at the same time, we need to tighten somewhat to ensure that our safe distancing measures are in place. A couple of weeks ago, we also tightened in terms of the enforcement of safe distancing in the F&B sectors, in the community areas, to make sure that people observe these rules and take these rules seriously.
Put in temporary living arrangements, and in order to ensure everyone's safety, we tested them one time, but then we put them through a second test, a third test, and even in the second and third cycles, for that group of workers, even in the second and third cycles, we continued to pick up positive cases. Right, so not surprisingly for this, the group of workers who are in the dormitories, who are, despite that going through a comprehensive clearance process, we are now only going through the regular testing. We started in August, and we have not completed 2 or 3 cycles yet. But as we do so, as we complete a few more cycles of testing of these workers, I'm sure the numbers will come down steadily. So we are working on all fronts, and we hope to see the numbers continue to decline.
I should add that while we all hope to see 0 cases in the dormitory and in the community, but I must remind all of us that it doesn't mean that there are no COVID-19 cases in Singapore, because there will still be asymptomatic cases, undetected cases. Even with RRT, if you remember, it's currently on a 14-day cycle, and in between the 14 days, workers can get infected and undetected until their RRT is due. And therefore, we are also increasing the frequency of the RRT for the high-risk groups to make sure that we are able to detect them as fast as possible. And if we do that rigorously, we will be able to continue to keep the numbers low, but it may not reach 0. Even in the community today, as you can see, from time to time, we do get 0 cases in the community, but it comes back because there's no possibility of a 0 case in the whole of Singapore until we have the vaccine available. So therefore, I think we need to continue to be vigilant. Even if we see one day 0 cases in the dormitory and 0 cases in the community, we cannot afford to celebrate, because the day after that, it may not be 0, because there are still cases in the community being transmitted, and we have to remain vigilant.